Roberto, thank you very much for coming.
You're welcome.
You work and live in Italy, in Milano.
Yes.
Can you tell us something about how you became a homeopath? What initiated your passion for homeopathy?
Yeah. So I was studying in the university, and I was on the third year of university. And at a certain moment, I was doing my training in a neurological department, and I started to have all the neurological diseases. So my tutor started to give me allopathic drugs, but I was not better. So a friend of mine told me, "Why don't you go to an homeopath?" And I told him, "What is an homeopath?" I never heard about homeopathy. And so he explained me a little bit, and I was really skeptical about it. But anyhow, I went to this man, and when I saw him, he was terrible. I thought, this is not a doctor, he's a butcher, perhaps. And then he started with his consultation. And for me it was terrible, because he started to ask me, do you like ice cream, or do you like to stay in company, and what about this, what about that? And I thought, what is this? So after the consultation I went to my friend, and I told him I will never take this candies. And he insisted, why not, you need this. So I decided, at the end, I decided to take these remedies. This remedy was one remedy. And the day after, exactly the day after, I was much, much better. And so I came back to this doctor, and I asked him, may I have something to read? And he gave me the lesson of homeopathic philosophy of Kant. And I read all the book in one night. I was so enthusiastic. And so this was my beginning. Then I started studying homeopathy and then acupuncture. And I was doing during my university studies. So when I finished I took my degree in medicine, I was also an homeopath. So I started working as an homeopath from the beginning. So this is more or less my story with homeopathy.
Well, so you actually came to homeopathy by your own suffering, and...
Yes.
Okay. Can you tell us something about the concepts you have integrated in your daily work, which teachers influenced you?
Yeah. So I was taught, especially the man that taught me more was Franz Goekens. I was in Belgium for 4 years with him. But at a certain moment, I felt the necessity to have something more. I mean, what Franz told me and taught me was incredible. But I need something more. So I started to study also other authors, and at the end I came to the conclusion that themes and concepts could be a good integration of my work. And I started to think to do a work especially for children, because I also always had difficulties in doing consultation with very small children. And so I thought of these concepts. I discussed a lot with Frederick Scroyens, who's a very good friend of mine. And at the end, I came to the conclusion of his concepts of his book. So I created 20 concepts, and I took almost 3,000 rubrics from the repertory, and I divided in these concepts, and I think could be a good tool, because you have information, for example, about school or about non-verbal symptoms, and it's not always so easy to find these topics in the repertory. And in this way, I think is much more easier. This was the first work. Now I'm working to the new project that is to divide in teams all the mental symptoms. So it's a bigger task that I'm doing.
When do you think you will finish this task, this work?
Perhaps 10 years. I don't know. I really don't know. Also because I'm studying the structure, yes. And little by little you have new ideas and you change a little bit. So I'm working since 2 years on this project, but I'm still thinking about it. But I hope in about 2 years to have the new work ready.
Today I spoke with a participant of the seminar, and he said that he have read all those 3 books, one of the concepts from himself, okay. And the book of Farrock and the book of Mr. Pfeiffer. And he said the main influence came from your book because it was an eye-opener for him how you developed this concept with the non-verbal information, and it really gave him a clue to treat very little children. Can you say something more about those non-verbal informations, about those concepts you developed?
Yes, about non-verbal informations, non-verbal symptoms, I took about almost 1,000 symptoms from the repertory. And I think it's very good, not only for pediatricians, but also for veterinarians. Because also in veterinary practice, you don't have usually patients that speak so much. I divided also, because we have 20 concepts, but then every concept is subdivided in other sub-concepts. So for example, non-verbal symptoms, you have gestures, you have symptoms that the doctor can observe when the patient is talking. You have symptoms where you need to do the visit. So, for example, if you want to see something about the ear or other symptoms where you need to visit the patient. Or you have also non-verbal symptoms that you cannot see in your practice, but parents can see at home. For example, epistaxis, washing the face. This is a non-verbal symptom, but you never see in the practice, but parents can tell to you. So this division can help the homeopath also in developing the consultation, because the concepts are divided, but you have, for example, at the beginning you have the personal and history, personal and family history, and then you have the development, you have the dentition, you have the vaccination. So you can go through the concept and go to the last one, to the last concept, and you have almost every topic that you can cover in the children consultation.
So you always ask the parents if they see any strange signs at home, which may be helpful for finding a similar.
Yeah. I mean, this is a help, and it's an help especially for homeopaths that does not know enough the repertory.
Okay.
So you can ask questions. You go to the concept, for example, school, and you know which information you find in the repertory. Yes. So it's much more easier in this way.
To get it a little bit more clear, you may give a practical example from your own clinic.
I think that is very important when you use the concept to put together rubrics. I will do an example. If you have a patient that have problems with reproach, usually we go to the repertory and we take the rubric ailments from reproach, and you have more or less 32 or 33 remedies. If you take the concept, so if you take all the rubrics with the same meaning, so meaning about reproach, and you have about 20 rubrics in this concept. You can put together this rubric and you go to 90 remedies. So you have the possibility to open your prescription. And this, I think, is important to prescribe the so-called small remedies, because otherwise you use always the same rubrics and you prescribe always the same remedies. So when you put together symptoms about the same concept, you open your prescription. So I say that I pass from the homeopathy of symptoms to homeopathy of concept. So no more ailments from reproach, but concept reproach. Okay.
Okay. So you put all those similar rubrics together and get
because of course, if you use my repertory is in the concept of radar, so you can put together all the rubrics and you can create only a big rubric and use this rubric. Of course, if you use the book, it's much more difficult because you have to take 20 rubrics and so on.
It's a big advantage of the computer.
Yes.
So what would you say, how many patients do you see each day?
It depends if I'm tired or not. No, usually it depends if I follow-up or first consultation, but in general from 10 to 15 patients every day. If usually I start working 8:30, 9 o'clock in the morning, and usually I stop 8 o'clock in the evening. So I'm a hard worker.
So you work the whole day. What does your family say to that?
Family in the night. No, I mean, for example, usually I take on Wednesday, the Wednesday usually is free for me. Yes. Also because often I'm teaching on Saturday and Sunday. Yes. Yeah. So I try to do my best, and some days I finish a little bit early, and so I can come back to my children in time.
This participant I talked today also said that with your book he found the so-called small remedies even in small children, because he said, how could I find mysterium in a baby before? We gave also some mind rubrics for the small remedies.
Yeah, I think that in my idea we have no small remedies. I mean, we have remedies that we don't know enough. So, with the experience of the work and using in a different way the repertory, we can go to the so-called small remedies more easier.
Yes.
And so do some kind of prescriptions. Also because I think that for example, I have perhaps more cases of barium phosphoricum than of nux vomica. And I know that this is strange, but if you understand some remedies, then it's much more easier to prescribe them.
Yes.
Yeah. So I think that we have, now I don't remember exactly, more than 500 remedies in my book. And most of them have also the description, so not only the rubrics but also the Materia Medica. And of course I wrote more about the remedies that I use more.
It was what I like most in your book, your own experiences and short abstracts you gave for the remedies. It's very valuable it's really practical information.
Thank you. And I underlined what is according with my experience, the most important symptoms of that remedy.
Yes. What would you say? What other influences did you have in your homeopathic career? What teachers? What people? Even
I like to say about myself that I am the homeopath in between. I mean, I try to put together the old and the new. But I don't use the exact method of other homeopaths. I try to learn and then I try to put together things and use them according with my way of doing homeopathy, according with my brain, and I'm sure that in some cases it's better to use one method, in other case another method, because if you have all the symptoms with repertorial rubrics, you don't need to go to another method. But if the patient does not give you repertorial symptoms, you have to think in another way. So I always went to listen to all the teachers, and I think that this is the best to put together the best from everyone. This is the reason, because I name my method the dynamic evolution system in homeopathy. So dynamic because homeopathy cannot be static. Also, every remedy is dynamic. So the remedy is in a certain way, in a certain part of the life, and then change. And evolution, because we need an evolution in our practice, because Hahnemann teaches us a lot of good things, but then we have more than 200 years of good homeopaths. So we need an evolution and system, because I think that we need a method. So this is the reason of dynamic evolution system in homeopathy.
Yes. So we always have to be flexible. We always
yes,
need to develop ourselves to improve our skills.
Yeah, flexibility is very important in homeopathy.
Do you use other methods than homeopathy in your clinic, or is this your main focus?
No, I mean, I'm a medical doctor, and when I mistake and I don't want the patient die, I can use allopathic medicine. Of course, I try to use allopathic medicine only if there is very, very difficult cases. And then there is another problem. I often see patients coming to me with very severe diseases, and it's not easy to stop allopathic drugs at the beginning of the homeopathic therapy. So usually I use homeopathy and allopathic drugs putting together, and when I see that there is an evolution, there is an amelioration, I decrease the allopathic therapy and I try to stop it. But I studied Bach flowers, I studied everything in the beginning, but then I tried to use only classical homeopathy, and I use only one remedy every time.
Yes, I think a lot of homeopaths went this way. They studied acupuncture, they studied herbal medicine, and at the end they concentrated on classical homeopathy. What would you say? How many? What's the percentage of children you treat in your clinic?
It's about 30–40% of my patients.
Okay. What do you think is does someone need or require to become a good homeopath?
Study, and practice.
Yes.
And no, I think that you have to think. Is very important in homeopathy. You cannot swallow everything without thinking. Otherwise, you need only a software and put symptoms inside and prescribe. Software are very important, can help us to go to the right remedy, but when you have to think, you have to do a hierarchy of the symptoms, and sometimes you have one symptom that is important and 100 that are not important, and you prescribe only on that symptom. So we have to, first of all, I think we have to learn very well the so-called big remedies, not because are most important, but because when you know very well big remedies, then you can exclude that remedies and go to the smaller remedies, the so-called smaller remedies.
Yes.
And so you need to study, and you need to understand, and you need to put things together and to go to the right prescription.
Yes. Yes. What do you think is the most difficult moment in a homeopathic treatment?
In the homeopathic treatment or in the homeopathic consultation?
I would think both.
Both. So, most difficult. So, in the homeopathic consultation, I think the most difficult moment is when you are convinced of a remedy and then you don't get enough confirmations, and then you have to start from the beginning to search for another remedy. About the homeopathic treatment, I think that the most difficult moment is when the remedy does not work anymore. And this is the reason, because now since about 10 years we are working not only with the right remedy. I think that we need not only the right remedy, but we need the right potency, the right repetition, and also the right quantity. Because I have seen in many cases that if you give different quantity of the remedy, you have a different response. And I'm not talking about psychological cases where you give three drops or you give 5 drops and there is something different. I'm talking about blood examinations. So I think that also quantity is very important. The difference of quantity is very important. And this is the most difficult moment, because when you try with another potency and another potency and you give different number of drops, different repetition, and the patient is not improving, this is difficult. And then you have to think if you have to change the remedy, not because I'm thinking that we can change constitution, but you can have different situation and the patient could need different remedies according with the logic of prescription, because according with my idea of homeopathy, you cannot prescribe different remedy without logic. So for me it's very important, for example, to follow complementary remedies.
Okay.
The problem is that sometimes we don't have enough informations about complementary remedies. For example, in children, I thought that phytolacca is very important in phosphorus patients during dentition. There's precise symptoms, and I discovered in one phosphorus patient, and then I have seen another one, and now when I have a phosphorus patient, always think of phytolacca during dentition. So we don't know everything.